Welcome to this important breakout session looking at implementation realities, and in this case looking in particular at the patient safety critical issue of how to advance bedside scanning across Europe's healthcare systems. But before saying a little bit more about the topic and our speakers this afternoon, I'll just briefly introduce myself. I'm Richard Price. I'm the Policy and Advocacy Officer at the European Association of Hospital Pharmacists. We're an association of 34 national societies representing hospital pharmacy at the international level. For every hospital pharmacist, that when they arrive for work each day, patient safety is foremost in their mind, and so too with EAHP. Hence our great interest in this topic, and we're delighted to be facilitating the session. For the benefit of those who may be less familiar with the area, it's maybe just to describe what is point-of-care scanning. In essence, it's about conducting a vital final check of the medicine prior to being administered to the patient by conducting a scan of the medicine versus a scan of an identifying patient bracelet. In essence, that is to check that it is the right medicine at the right time for the right patient in the right dose and by the right route of administration. Studies have shown what a powerful impact that can make in reducing medication error, and in health systems such as the United States, we see that becoming quite a standard practice and great advances being made in many other countries. Sadly, in the European context, for those of us interested in patient safety, we don't see the advances that we might otherwise like. The reason why, well, a lot of this, as our speakers will identify today, is to do with the issue of barcoding. In the hospital setting, when medicines make their way from the pharmacy to the ward, they are split from their original packaging, and without a barcode on that single unit of the ampule, the syringe, or the blister pack, the hospital has to conduct its own relabeling activity, which is just a cost burden too far for many hospitals. So this is the issue we're here to explore and discuss and debate. And I'm delighted we have three very expert speakers, each bringing their own perspective to the topic. First of all, we'll have Lieve from UZ Leuven, a large hospital in Belgium, which has successfully implemented bedside scanning as part of a larger computerized prescription order entry system as well. And she'll give us the day-to-day realities of the challenges of putting this in practice in the hospital setting. Sebastian from Roche will provide an industry perspective. Why is this sometimes quite a challenge to put the barcode to the single unit and how that might be overcome? And finally, we'll have the payer perspective. In Denmark, the purchasing organization Amgros has been able to make some advances in this area through the articulation of a single request in a clear way to industry. And then we'll open the floor, time permitting, to your perspective. You'll feel free to challenge anything you've heard or to simply ask for clarity on any of the topics raised. So I think we'll get started, and I'd like to invite Lieve to tell us about day-to-day use of bedside scanning in Leuven. Wonderful slice of real life in hospitals from a healthcare professional who's living bedside scanning every day. And it was a great overview of what UZ Leuven has managed to achieve with their system. And also as well, it touched upon some of the wider ranging benefits that UZ Leuven have achieved from scanning, not only for patient safety, very important though that is, but also in some other areas like logistics improvements and environmental improvements, and some exciting potential developments in patient compliance. So Lieve left us with a very clear message, a clear request to industry. Please help us to help patients. Please move closer to barcoding to the single unit at the point of manufacture so that bedside scanning can become a greater reality in Europe. I think that opens the floor then for a right of reply, and I'd be delighted if Sebastian from Roche Pharmaceuticals could explore with us some of the challenges that are faced in single unit barcoding.